India's healthcare system, clearly, as Neeta Sharma was pointing out there, is overwhelmed. There's a critical shortage of beds, of medical supplies, of oxygens, of medicines. And most of us, if we can, terrified as we are, as we hear of the stories around us, as we hear of these stories being shared by family members on WhatsApp, we're staying at home. We're doing our best, doing everything we can to protect ourselves. But not everybody has that luxury. Healthcare providers, like nurses, they are out there daily. They're fighting COVID on the front lines to safeguard others, to safeguard our loved ones, the lives of everyone affected. And they're going out to work every day to save the lives of those infected by the coronavirus. COVID has disrupted our society, but of all the sectors, this one profession has remained working day and night. They work these long shifts without a break, without the possibility of a holiday, and this has been going on for over a year now. They're the critical line of defense. But what are the hurdles that nurses face during this battle? Today, let's dedicate this show to them. Let's try and talk to them. Let's get their story. Joining us now, we're so grateful to have Harsh Kumar Kalja, President of AIIMS, the AIIMS Nurses Union, Aarti Dutt, the Chief of Nursing at Max Saket, Famir CK, the General Secretary of the AIIMS Nurses Union, and we have Captain Usha Banerjee, the Group Director of Nursing at the Apollo Hospitals Group. Thank you all for joining us. You are the Indians of the year. You are our real COVID heroes. Let me ask first, if I could start with either Ma'am Aarti Dutt or Usha Banerjee. You know, nurses, you're on the front lines of this outbreak. You're exposed to hazards that put you at risk of infection. It's important that you're all protected with protective gear, right? Masks, robes, eye covers, face shields, gloves. But all of that, of course, ma'am, must make doing the job so much harder. We're seeing these videos of nurses, you know, at the end of their shifts, completely drenched in sweat. Women nurses, I'm assuming very hard for you to take a break, to go to the restroom. If you're on your cycle, it must just be horrific. Ma'am Banerjee?
Well, Ms. Sarah, thank you so much for having me up on the show, and I represent the entire nurses of this country. At the outset, I think I pay tribute and homage to all those who have laid their lives down and have become COVID martyrs, all the healthcare workers, including the nurses. And I also pay my salutations to everyone who has been battling at the front lines. And nurses form the largest contingent, working very silently, relentlessly, tirelessly, round the clock, 24/7, 365 days. And I must admit and tell you, many nurses are very young. They have small children, they have families to tend to, and we are working round the clock, 24/7. Many of us have not gone home, and I'm sure that's the case with most of the nurses. And I must tell you that probably the doctors have got their lion's share of recognition in this entire COVID crisis, but there are many nurses and the rest of the support services who are toiling it. And as you have rightly put it, that, you know, they sweat in those PPEs, it's long, tiring hours, patients are critically ill, we have augmented beds, there are crisis situations. But I'm so proud that every single nurse has risen to this occasion and has contributed, and they continue to work. So proud of them, and we speak this as we gear up for the International Nurses Day, which is on 12th of May. So I think there should be a national glorification for this profession, and so that the best of nurses work in this country and we have better healthcare infrastructure and competence in the nurses who can take care of our patients and citizens of this country.
Absolutely, ma'am. We haven't done enough to highlight the work that the nurses are doing. Something you said really struck me. You talked about how nurses work silently. You know, there must be so many psychological changes, ma'am, that fears of infection among nursing staff, that must be really hard to handle. The knowledge that you know that somebody who's you're working with, one of your colleagues, has caught COVID while caring for others. We've seen cases in the papers of nurses who haven't gotten a bed in hospitals that they worked for and served in for decades. Aarti Dutt?
Yeah, thanks for having me here, and I would totally agree with the Ma'am Usha that yes, of course, the nurses, they keep working silently, but now it's over, I think it's almost a year. The nurses have become very strong to take up this challenge. And you know, the best part is this, that now the nurses, they just pitch in. and they come up saying that we need to do the duties and I am here to work for, and they keep their personal life absolutely aside. That's very positive sign which I am seeing this time. This is the most, I think, difficult phase we all are facing. But the nurses, the kind of nurses, they are coming up, they are taking the challenges, and they're used to PPEs. Wearing these PPEs become absolutely now a routine. So yes, we keep training them, we retraining them. We have short sessions with them. We all, they forward for their duties. We go there, we mark their names on their PPEs, so they feel so honored. That boost them up to come up with a very positive energy and care for the patients. Of course, young nurses, it's very hard to say, like, see.
All right, let's, ma'am Aarti Dutt, we're just having some trouble hearing you clearly, and I don't want to miss out on what you're saying. So let's just try and get ma'am back. Famir CK joining us. Famir, the nurses see the worst of this illness, and the worst of this illness is that it's so isolating in its nature, right? You have patients dying by themselves. They can have nobody there from their family who can just even hold their hand in their last moments. The only person actually there is the nurse, and we've heard so many stories where nurses have managed to use their own phones to connect patients with their family members, maybe one last chance that they can talk to them even as they're being incubated, or holding up the phone so that family members can see just what the nurses are trying to do to provide them some sort of comfort, to know that at least the nurses worked to save them. The goodbyes, all of this taking over FaceTime, that's an additional responsibility, it seems, for me, in this pandemic for nurses.
Yes, hello.
Hi, Famir, we hear you.
Yes, madam. Yeah, actually, madam, it's a really challenging situation for the nurses, and I just want to congratulate all the nurses who are tirelessly working for the welfare of the patients. As you said that in the COVID ward, its situation is entirely different. While we compare it to the other areas, the patient will be totally isolated from the outside environment. They'll be seeing only COVID patients in and around them, and they'll be seeing some figures, those who are moving with some plastic aprons or PPEs moving around them. So they are not even able to see the face of the healthcare workers. They are not able to see the emotions. So it's a difficult situation for the patient from the patient's point of view. And by seeing this and all, as ma'am said, nurses have learned to tackle the situation from the last 1 year, because they are come up with a very strong attitude and mentality to cope up with the situation. Because from the patient point of view, we can see that when the most strongest person will be in a deteriorated condition in the COVID ward, and they will be in a state of delirium, they'll be in a confused stage, they'll be away from the family. It's a very difficult and tough time for the patients. And as nurse, I'm very proud to say that we are able to provide empathetic care for the patient, so that we are able to replace their emotional needs, even though it is not 100% not possible, but still we are trying from our level best for this.
Thank you so much for that, because really in the end all these patients have alone in these ICU wards are the nurses, and we hear so many stories of nurses reaching out, just being there with patients as they pass away, just at least giving them a hand to hold. But Mr. Harish Kumar, these are experiences that nobody should have to experience. These are sights that nobody should have to see. Yes, our nurses are so strong, they're stronger than everybody else because they're on the job during the day and at night. The doctors come, they check on you, but it's the nurses who have to carry out, the feeding, the cleaning, being with the patient all the time. But what about burnout? Isn't there burnout among nurses?
Yes, ma'am. It's very horrible conditions too. बहुत मुश्किल हो रहा है काम करने को लेकर कि जहाँ पे जो हमारा इंडियन हेल्थ केयर सिस्टम है या जो पूरे वर्ल्ड का हेल्थ केयर सिस्टम है, उसमें नर्स एक बहुत बड़ा इंपॉर्टेंट रोल निभा रही है आज इस पेंडेमिक में। जहाँ पे एक पेशेंट पहले जहाँ अटेंडेंट हुआ करते थे हॉस्पिटल्स में, आज वो अटेंडेंट नहीं है, नर्स को बहुत ज्यादा काम करना पड़ रहा है और वो अपने आप को कहीं ना कहीं साबित कर रही है। और ये जो स्टोरीज हैं कि एक नर्स की लाइफ स्टोरीज है, ये हर एक नर्स की स्टोरीज है कि जहाँ पे हर एक नर्स के घर से बीमार है, हर एक नर्स का बेटा पॉजिटिव आ रहा है, कहीं उसकी बेटी पॉजिटिव आ रही है, कहीं उसका हस्बैंड पॉजिटिव आ रहा है, कहीं उसकी वाइफ पॉजिटिव आ रही है। तो ये घर घर की कहानी के रूप में निकल के आ रहा है। लेकिन इतना करने के बाद भी हमारी नर्सेज दिन रात लोगों की सेवा में जुटी हुई है। और जहां से खबर आती है, कहीं मीडिया जगत से, कहीं किसी बड़े एमिनेंट पर्सनलिटी के द्वारा, आज अभी यूएसए प्रेसिडेंट ने भी एक 7 मई हमारा इंटरनेशनल नर्सेज वीक का शुरुआत हुआ है, वहां पे प्रेसिडेंट ऑफ यूएसए ने हमारे लिए बहुत अच्छी लाइन लिखी है, ट्वीट किया है। तो ऐसी चीजें हमें कहीं ना कहीं एनकरेज करती है। और हम घर पे बात करते हैं कि आप कैसे हैं, तो घर की तरफ से ये आता है कि आप अपना ख्याल रखिएगा। इसके बाद ना हम कुछ बोल पाते हैं, ना हमारे घर वाले कुछ बोल पाते हैं। एक बड़ी इमोशनल स्टेज से हम गुजर रहे हैं, लेकिन मैम कोई दिक्कत नहीं है। मैं तो इतना ही कहना चाहूंगा कि ये एक बड़ी लड़ाई है, और इस लड़ाई में जो सेना है वो नर्सेज है। इस नर्सेज रूपी सेना का जो कॉन्फिडेंस है वो सेनापति से बड़ा होना चाहिए। यानी कि हमारा जो सिस्टम है उसके कॉन्फिडेंस से बड़ा कॉन्फिडेंस नर्सेज का होना चाहिए। इसके लिए वो सारे मेजर्स यूज किए जाने चाहिए, और हम बहुत हद तक हमारा काम करने में सक्सेस है। मैं
पर मिस्टर कुमार, फिर आप करते क्या हो? क्योंकि जो आप कह रहे हो सही है कि कोविड इज एवरीवेयर, नोबडी इज मैनेजिंग टू एस्केप इट, एवरी हाउस has a story, everybody seems to be going through their own little personal health. तो जब आप कह रहे हो कि तो rosters कौन बनाते हैं? क्योंकि even in our office the most unenviable job is the job of the person who's making the roster. जब आप कह रहे हो कि नर्स के अपने घर में अपने बेटे अपने बच्चे बीमार हैं, तो वो कैसे आएंगे काम पे? So everybody is short staffed, and the nurses are pitching in for their colleagues who can't come in, working over and above even their overtime.
यस मैम, अभी हमारे बहुत से एम्प्लॉइज हैं, नर्सेज हैं, वो कोविड पॉजिटिव हैं। उनके डिफरेंट रीजन हो सकते हैं। वो खुद पॉजिटिव हैं तो उनको होम आइसोलेशन पे हैं, लेकिन उनके घर पे है, उनकी भी उन्हें केयर करनी है, उनको भी आइसोलेट करना है। लेकिन वो खुद एसिम्प्टोमेटिक हैं या नेगेटिव हैं, तो वो अपने काम को बखूबी कर रही हैं। लेकिन उनका इमोशनल स्टेज वो देखिए मैम कि वो कैसे है अपने बच्चे घर को मैनेज करके भी अपने काम के साथ उसमें बड़ा तारतम्य बैठा के वो कर रहे हैं। मैं तो कहना चाहूंगा कि हमारे इस प्रोफेशन में जो फीमेल्स हैं उन्होंने बड़ी बागडोर संभाली हुई है, और कहीं ना कहीं इस हेल्थ केयर सिस्टम को हमने बचा के रखा हुआ है। तो मैं धन्यवाद देना चाहूंगा उन सभी फीमेल्स का कि ये बड़ा टफ जॉब है एक फीमेल के लिए कि वो घर मैनेज करे, यानी कि वो भी एक तरह का जॉब है, और अपनी जहां उसका जॉब है उसको भी मैनेज करके चले।
Absolutely, yes, sir. Thank you. You've acknowledged that, and we need that acknowledgement from more people at the workplace. Ms. Banerjee, last word to you. What message would you give to our viewers? Everybody's, if they have someone in hospital and they're stressed, they want information, and people react badly often, what message would you like to give on behalf of nurses all over India working? What message would you like to give to any of our viewers who are watching?
I think nurses have risen very tall in this war. It's a brutal war. The nurses are human too. They have left everything aside to ensure that the patients are taken care. And trust me, no nurse will ever compromise on patient safety or patient care. They will go out of their way to do whatever best they can for the patient they are caring for. And their heart goes out to every single human being who is suffering today. So it's not just their patient. They're trying to reach out to community, to people, neighbors, try and be of any use and help to every single citizen, because it's a war situation. And I'm so proud that even the youngest nurse to the eldest nurse has wanted to contribute in some way or the other. And I know many of them reach out to me and say, ma'am, when will I get a COVID duty? They would have just recovered from COVID. They would have had family members, as the gentleman said, but everything put aside, I think it is time for every single citizen of this country to honor and value the contribution of nurses. And I said national glorification. Today, the president of US has tweeted, yes, we want such kind of things because that will improve the morale. And I think nursing should be placed prominently in the healthcare system so that nurses become the true advocates of patient care.
We should use this as a learning moment. We should come out of this at the end with some changes on the ground for the position of nurses at hospitals, the way we treat our nurses too. Thank you all. We cannot do enough to highlight what you all do as nurses. We thank you for your service. We thank you for your time. That's the news at this hour. Bye-bye.